A very good morning to you. And in the studio this morning, a pleasure as always to welcome my next two guests. It's Greame Tobyn and Veda West. A very good morning to you both.
Good morning.
Good morning.
And I will let you introduce yourselves as you so competently do.
Thank you.
Hi, my name's Veda West and I'm joined by my colleague Greame Tobyn. And we're medical herbalists and we run the Preston Herbal Clinic, which is based at the Remedy Centre for Health, Ashton, Preston.
So what are you going to talk about today, Veda?
So today I'm going to talk about psoriasis. Psoriasis is a common condition and where there's inflammation of the skin. And it's worth noting that there are different types of psoriasis. For example, there's plaque psoriasis, pustular psoriasis, nail psoriasis, guttate psoriasis, and that typically follows a sore throat, which is caused by a bacterium, and others. So plaque psoriasis is the most common form, and this looks like well-defined, raised, red patches covered with silver scales. And these normally appear on the elbows, knees, scalp, and lower back, but can actually appear anywhere in the body. So while some people get flare-ups or small patches of psoriasis, others may get larger patches or smaller patches which are very near to each other and merged together. And what's happening in psoriasis is that normally skin cells renew every 28 days, but in psoriasis this regeneration is happening a lot quicker, usually 2 to 4 days. So rather than shedding the skin cells, they pile up and you get these lesions.
It's amazing, really, to think the body's such a wonderful thing, isn't it? That the skin renews itself every month. I know,
and it's easy to forget all that, isn't it? You know.
So in psoriasis, that's just happening too fast.
Yes, exactly. It's just too fast, and that's causing all these symptoms of the raised plaques.
Yeah.
And what you tend to see is that people with psoriasis have flare-ups. So there may be times where there's no symptoms or minimal symptoms, and then there's a period where the symptoms are far more severe. Itchiness tends not to occur, though sometimes it can occur in something like chronic psoriasis. So, you know, it's possibility.
People are different, aren't they? Sometimes it does happen.
Yeah, and this is the thing of psoriasis isn't just the same in everybody. No. It varies. And we are all different. And some people, I believe about 20% at any time, may suffer from psoriatic arthritis. And this causes tenderness, pain, swelling in the joints and connective tissue.
Runs in families, doesn't it?
Yes. There's no cure in terms of treatment, both orthodox and alternative, really aims to control and alleviate the symptoms. So I was really talking about worsening the sort of flare-ups and trying to get them a bit further apart, so it's less severe. The cause is debated. There's some evidence that genetics are involved in some people, and also the immune system has been shown to be involved in this. So
yeah. So what can trigger a flare-up of these psoriatic lesions?
Well, for many people, there may be no apparent reason. However, for some, they may get flare-ups in certain situations. For example, if you were feeling very stressed, that may cause a flare-up. Infections, some medication, smoking, trauma to the skin, sunlight, hormonal changes and alcohol have all been shown that in some people they may cause a reaction. So to me, it's really about looking for patterns, and getting to know your body, and seeing if what could potentially cause that flare up. I
mean, the sunlight's an interesting one, because I always thought that helped, and certainly patients I've treated all seem to have benefited from sunlight, but that's not completely true, is it?
No, for the majority, and certainly like the majority people I see, sunlight fantastic. It really, really helps to control symptoms. And these are the times where you think people come in and say, well, actually in summer or being on holiday, my psoriasis has improved, but in winter it's not so good. Some people, a small minority, find find that sunlight, particularly if it's quite strong, can actually worsen the psoriasis. So this is all about us being individual again, isn't it? And kind of working out what's aggravating or relieving it for the person.
Yeah. So what can people do to help themselves? I mean, once they understand their own individual example of having the condition.
Well, as mentioned, stress can cause flare-ups. So a really simple way to kind of help with this is to drink herbal teas. There's herbs like chamomile, lemon balm, valerian are all very relaxing. And obviously, if there's a stress in your life that you can kind of remove, brilliant. But it's not always possible. And so we're looking at strategies of sort of relaxing and keeping calm. Yeah. Oily fish in a diet, such as salmon, herring and mackerel, all contain omega-3, and these may help. Also, if you're a vegetarian, you can get omega-3 from things like flaxseed, and you can buy that at health food shops very easily. And topical creams can help to reduce local inflammation and to remove scales. So ones I particularly like are calendula, comfrey and licorice. Now, calendula is very anti-inflammatory and healing. Comfrey is very healing, can actually help sort of regulate the sort of turnover of cells. And licorice is anti-inflammatory, and I tend to use that quite a lot. And these are really good, but they're not really addressing the root of the problem.
No.
That's my issue.
Yeah, that's my understanding as well, that the topical creams are just treating the superficial symptoms but not getting at the root cause.
Yeah. And I think it's important to have topical creams. But, if you... Personally, I think you need sort of internal treatment. So herbal medicine, so in the form of tinctures or teas. And it's really worth noting that, as we've mentioned a few times now, no one person is the same. So psoriasis affects people slightly differently. And in light of this, no one prescription for psoriasis. There's not one magic prescription. It really depends on that person and picking the herbs, to suit that person. And the way we both prescribe is to use several herbs in a mix. So they're really tackling the different areas, different aspects of the psoriasis.
I think it's worth saying that from the herbal point of view, there are actually different treatment plans you can follow, and if one doesn't work, another may. So because it's a complicated and chronic condition, it might take two different approaches to actually make large inroads into the condition.
Exactly. Yes, definitely. And there are particular herbs which I tend to use, or types of herbs. So the herbs I may include are known as alteratives, liver herbs, or herbs to support the immune system, and nervines. So I'll go through them briefly. So alteratives are traditionally known as blood cleansers.
Yeah, now that's a difficult topic, isn't it?
It is.
They don't really cleanse the blood. I mean, the research you did I like the definition as herbs that generate a favourable change or alteration in the process of nutrition and repair of tissues or of the body in general.
Yes. It's actually quite a difficult thing to define, isn't it? Alteratives. And we have examples of these herbs around us. You'll know many of them. Things like cleavers or goosegrass, nettles are alteratives. One that you may be less familiar with is figwort. And it's the right time of year to be picking things like nettles and cleavers. So, just make sure that you identify them, and you can use them in tea, in soups, and cook with them. However, I think you really need some sort of hepatic alterative, and these are ones which work on the liver, and these are ones where I really see results. So we're really talking here about things like burdock, blue flag, Oregon grape. There are many others actually. And herbs to support the immune system may be indicated, because we've, as mentioned, there's an immune system dysfunction going on there.
It's going to be an individualised prescription.
It's individualised, and it's really just picking the right ones. And, you know, if something like stress is an issue, we've got herbs which are nervines, and these basically just support the nervous system. So things like verbena, skullcap can really help, but there's quite a range actually. So Greame, are there any particular herbs that you like to use?
Well, yes. I mean, a key herb for me in terms of that anti-inflammatory and alterative approach is sarsaparilla. People may be familiar with sarsaparilla. It's still sold in one or two shops up this way, but we're talking more about a medical preparation of sarsaparilla rather than the sort of sweet drink that you can get. But that for me is a key herb, Veda.
Yeah. So, Greame, what are you going to talk to us again?
I'm going to talk today about heartburn and indigestion, and the primary feature about both of these is discomfort or pain. Now, indigestion seems nowadays to be taken to mean discomfort in the stomach, Veda, rather than what we might have thought about, a more general description of dysfunction of digestion, especially on or just eating. And then heartburn is a rising pain that comes up behind the sternum or breastbone, up even as high as the throat and mouth. And that pain typically appears on lying down at night, for instance, or for gardeners, you know, stooping over. So what are normally prescribed for these? Antacid drugs are routine, and patients might find themselves on a drug called PPI, protein pump inhibitors. One name is omeprazole. These are frequently prescribed as well. Now, herbalists are keen to offer their own remedies in preference to these because a number of antacids contain aluminium, which may not be good to take in the long term, and the PPI drugs appear difficult to give up once started. And indeed, there's concern now about them being overprescribed by doctors. Herbalists advise on diet and lifestyle changes along with prescribing their gentler herbal remedies. So the discomfort or pain of indigestion may be accompanied by a sense of feeling full or bloating, with nausea and belching. And the symptoms are thought to be due to inflammation of the lining of the stomach by stomach acid. Now, what can increase stomach acid? Well, stress can, as you've been talking about in relation to psoriasis, Veda. And, so that may be a contributing factor. Other drugs, non-steroidal anti-inflammatory drugs such as ibuprofen, can inflame the stomach wall and provoke pain as well. So that's a well-known side effect of those type of drugs in susceptible individuals. Excessive amounts of alcohol can do this too. Where the sphincter or the valve that closes off the top of the stomach is over-relaxed and open, what happens then is that the stomach acid escapes into the esophagus or gullet, and its lining is not designed to accommodate stomach acid. So this becomes inflamed and produces pain rising up behind the breastbone, and that is heartburn. In fact, the medical name for heartburn is gastroesophageal reflux disease. Another class of drug called nitrates, taken for angina, can also cause the valve to relax and produce this symptom. Equally, obesity, that increases intra-abdominal pressure, and that sort of causes stomach acid to be pushed through an over-relaxed valve. And actually that's not far removed from what happens in pregnancy, with the pressure of the fetus from down below. Smoking is also thought to relax the valve, by the way. In recent decades, it's been recognised that symptoms of heartburn or indigestion may be due to an infection of the stomach by a pathogen called Helicobacter pylori. Do you know about the discovery of this?
Yes, it was discovered by 2 Australian doctors, but I believe it wasn't immediately accepted by the medical profession, and one of them deliberately infected themselves, then cured with a combination of drug treatments to get funding for trials to establish an infective cause and its treatment. Is that right, Greame?
Yes, that's correct. I mean, and it's sort of seems to be part of the history of medicine that doctors experiment on themselves to demonstrate their findings. So what it means, Veda, is that if heartburn is ongoing and hasn't responded to simple treatments, then that needs to be checked out to find if there is an infection in the stomach. Talk about herbal advice, that includes stress reduction, weight loss measures where these factors are seen to contribute to the condition. Cutting down or giving up smoking and management of alcohol intake are also important where that's going on. But there may be other less apparent reasons for indigestion, and so it's really important to sit properly at the table when you're eating, in a sort of comfortable and relaxed manner, so you're not straining the abdominal organs with a poor posture as you eat. Tight clothing can affect the whole digestive process, so you need looser clothing to just allow the organs to do their job. And of course not being upset or tired when you're actually sitting down to eat. In my practice, I've assumed a link between cases of shallow breathing in a patient with the condition, because they're not using their diaphragm to breathe normally and deeply, and so there's a less than optimal tone in the adjacent valve or sphincter at the top of the stomach. So one of the additional measures I give my heartburn patients is to do very simple breathing exercises, which they always seem to manage successfully. When the valve is over-relaxed, stomach acid can more easily escape into the esophagus when you stoop or lie down, and so two things you can do to avoid that. First of all is to eat earlier in the evening and not to drink beyond a certain time of the evening, so that there are several hours for you to digest all of that, so you go to bed without food and drink sitting in the stomach. Another thing you can do is to raise the head of the bed, put bricks or a block of wood safely under the legs of the top of the bed so that you're sleeping at a slight angle, and that can help to keep the acid in the stomach.
So, Greame, which herbs would you sort of recommend?
Okay, I'm sure you've got your own choice of herbs here, but licorice is a well-established herb in this regard. In fact, there's a story, Veda, during the war, a Dutch doctor noticed that his peptic ulcer patients were all getting much better, but they were developing high blood pressure. He discovered that they were being sold licorice in substantial quantities by a pharmacist. So licorice heals, but if you take it for too long or too much of it for too long, it will slowly push the blood pressure up. And this can happen even if you have a fancy for licorice all sorts. So the dose is important, and you have to be careful about the use of licorice. So it's advisable to speak to a herbalist about how much it's safe to take without pushing up the blood pressure. Another good herb for protecting the stomach is meadowsweet, which is often combined in a tea with chamomile flowers, which are anti-inflammatory, so that's a very pleasant tea. Then we have the demulcent remedies. They contain mucilage that coats the lining of the stomach to protect it. So two key herbs here, slippery elm, which people or older people may have heard of. You make that warm as you would cocoa with water or milk, and then adding honey and maybe a pinch of something aromatic like cinnamon to give it flavour, and that taken after or between meals will help a lot. Similarly, marshmallow root, although the way to make this is to soak it in cold water overnight and then drink that strained liquid after or between meals the next day. Finally, St. John's wort can also be used, but not as a liquid or tablets as it is taken for depression, but using the red oil made from macerating its fresh flowering tops in olive oil in the summer sun for up to 40 days. So you make that in the summer. Long ago, St. John's wort was most famous as a wound herb, and drinking a little of the oil regularly can heal an inflamed stomach lining. So these are herbal approaches to solve infrequent and no more than moderately painful indigestion and heartburn. But severe or regular pain, despite simple measures, or any blood brought up or passed down, must be checked out for other possible diagnoses and causes by a health professional. That's our info for today, Huey.
Brilliant, thank you. As always, a pleasure to have Greame Tobyn and Veda West in the studio with our natural health feature.